and welcome to Third Rail with Nick Beaton. I'm Nick Beaton, and I host this weekly podcast where I talk about all the issues and hot-button topics of the week, but I try to add a little bit of perspective and logic into this increasingly politically polarized world. Thanks so much for tuning in. Please don't forget to rate, review, subscribe to this podcast, and also follow me on Twitter at Nick_Beaton. Visit my website, nickbeaton.com, where you can check out other content. And now, on to the show. Thanks for tuning in for a special episode of Third Rail with Nick Beaton. On this week's episode, I talk with Brandon Doucet. Brandon Doucet is a dentist from New Brunswick, now living in Newfoundland. He started an organization called Coalition for Dentalcare and had an article that went viral titled A Dentist's Plea for Truly Universal Healthcare. Go give them a follow, Coalition for Dentalcare, on Twitter, Facebook, Instagram. It's a really good fight. They're basically fighting to try to get dental care covered in our universal healthcare system. It was a really interesting conversation chatting with him. I hope you enjoy it. And now it's time for Brandon Doucet. All right, so I'm here now with Brandon Doucet. Brandon, nice to have you on the podcast. Thanks for joining me.
Thanks for having me.
No problem, man. So you're a dentist. You're from and still based out of Newfoundland?
I'm originally from New Brunswick, but since graduation I've lived in Newfoundland.
Oh, okay. So I got the wires crossed. Either way, East Coast, but
yes.
Newfoundland is still definitely a separate entity to the East Coast. I'm from Cape Breton originally, so we're like
okay,
Newfoundland
awesome.
light.
It's a beautiful area.
Yeah, no, it's great. So how long have you lived in Newfoundland?
It's been almost a year and a half now. It's a very beautiful area. Lots of, if you like the outdoors, it's a place to be.
Yeah. I've lived now in Toronto for about close to 20 years now, and I grew up in Cape Breton. I definitely like I like when I get out there, and I like the scenery, and it is nice. But I don't think I could ever go back to not living in a city. I think it's just different mindsets. I'm not an outdoorsy person, so.
It's definitely a change of pace. Yeah,
for sure. So you, this is from an article that you wrote. It's called "A Dentist's Plea for Truly Universal Healthcare." That's been your goal for how long now? How is that? How you've obviously, as a dentist, you have firsthand experience of everything that happens. So when did this sort of strike you as something that is absolutely necessary to include dental health as part of universal healthcare that we have in Canada?
So I think I was aware for many years that dental care wasn't included in our Medicare system, but fortunately, I was in a position growing up where we were still able to access care. I think what really highlighted this need for me was when I began my clinical rotations during dental school. You would start to see people coming in their 20s and 30s needing all of their teeth out. And to me, this was a big shock. I was kind of set back by this and started to realize that many people's experience didn't align with mine. And I started to kind of scratch beneath the surface and read some of the research and realize that this isn't just the odd person falling through the cracks. There's really structural problems with the way dental care is structured that makes it so that so many people fall through the cracks.
Yeah, I definitely have some firsthand experience with that. I maybe get into that a bit later. But it has been something that I thought of as weird for a long time. This issue has been very important to me as well. It just seems like a basic aspect of healthcare that's very ignored but accepted as it's ignored. It's just sort of something people that's the system. You go to the hospital and you get treatment there, and there's lots of different treatments that you get past emergency room treatment like they have in the United States. Is pretty much just emergency room treatment. Then everything else is a a very expensive bill. Whereas in Canada, you'll get the treatments for diseases and different disorders and different things that you have. But when it comes to prescription drugs and dental and also mental health as well, these are three things that our healthcare system doesn't take. And dental care, I don't want to necessarily say which one is the more important of the three, but dental care seems very high up on the list because, as it's in your article, A Dentist's Plea for Truly Universal Healthcare, you cite, it has a lot of other health implications that are very grave. You know, if you have some health problems, what were some of the things you said? It can really lead to cardiovascular diseases. What are some of the other ones?
So there's various conditions. So within the medical side, poor oral health can cause or worsen cardiovascular disease, diabetes, having a low birth weight infant, aspiration pneumonia, erectile dysfunction, osteoporosis, metabolic syndrome, stroke. I'm sure there's many more as well, but those are just the ones that I dug up. And that's just purely from a medical standpoint. So when we're looking at the effects of poor oral health on overall health, there's also psychological aspects. There's also financial aspects. So you could imagine the negative things associated with being in poverty. Well, you're like not being able to afford dental care and neglecting it perpetuates this cycle of poverty. So it's very difficult to find a good paying job when you have visible decay on your front teeth, you're missing front teeth, or even, I mean, if you're living with chronic dental pain, it's really hard to sleep. It's hard to focus at work. It's hard to focus on school and all these different things. It really perpetuates these problems. And when this pain becomes too unbearable for people, oftentimes they end up paying for care on their credit card. So if somebody has a cavity on their front tooth and they need a root canal and say a filling, that can end up costing them $800, which is more than many people's rent.
Yeah, that's one of the things is with as I say, I had personal experience. So I have not been somebody who's gone to the dentist a lot. I have never had. Well, I only had a dental plan in my early 20s at a job that I had. It was a a day job. I'm a comedian, so now that I'm a comedian, I literally part of the what would be called freelance or gig economy. So there is no dental plan that comes with that in any shape or form. So I remember I had it in my early 20s. I had a dental plan through. I worked at Sobeys and I was full time, so I had a dental plan and even I had a problem, and the pain was so bad. It was one in one of my back teeth. So I went and they did a sort of a filling of sorts and said, well, this might not hold and you might have to come back for a root canal or something along those lines. It ended up not holding. The pain was so bad. It was, I was trying to work with it. I was just chewing Advil in order to deal with the pain. And even with a health plan, the other thing too, and this isn't necessarily an insane aspect of it, but it is kind of an annoying part of it where you have to pay up front, then get reimbursed later on. And at the time I was young, I was in my 20s, so I didn't have for the root canal that I was told I needed, in Toronto, it was, upwards of $1,500. So I didn't have that sitting around. I didn't have a credit card at the time with a balance because I was young and in my 20s and just didn't have one. So there was literally nothing I could do, even though I had a dental plan. So I basically had to pay what I could to get it, just the tooth pulled. It was a back tooth. And I was like, well, it's a back tooth, so just pull it. I can't afford this right now. But those are the decisions that people have to make fairly frequently.
Exactly. And it might not be a problem for one tooth, but many people have to make this decision several times. And then all of a sudden they're left with not many good teeth in the back to chew. Mm-hmm. And that's another thing that kind of gets lost is that when we talk about the statistics, we say over 1 in 3 Canadians lack any form of dental insurance, and about 1 in 5 Canadians avoid the dentist each year due to financial constraints. What gets lost in this is the fact that even of the 2/3 of Canadians who have dental insurance, many are what's called underinsured. So they have high co-payments, high deductibles, or they have a hard time finding a dentist who will accept their plan. So that's something that you had a dental plan, but your dentist required you to pay for the fees up front. I don't think that should be allowed, but I mean, it does happen. And it's also something that people who rely on the safety net that we have for dental care, something that they experience a lot as well, because targeted programs, which are these kind of patchwork social safety net programs for people who lack dental insurance, help a few people. So depending on the province, it can be, low income children, people on social assistance, but they're very underfunded because they only help poor marginalized groups. So they're, no one noticed when they cut their funding. So the fee guides that these programs pay out are often around half of what the private fee guides will pay out. So many dentists won't even accept people on these programs because the fees that the programs pay out are so low. Or if they do accept them, they will require them to pay the other half up front or pay the whole amount up front and get reimbursed for their half. Mm-hmm. And you could imagine if you're on social assistance, having to pay $300 for a filling is just out of the question. So many of these people just can't get care. And that's something that I've experienced. And I was kind of shocked in my early days after graduation. Personally, one of the things that brought me into dentistry was surgery. So I like kind of doing the surgical extractions, some of those more difficult cases. But as a new dentist, I wanted to inch forward doing these cases and not jump in the deep end doing the really difficult cases up front. Mm-hmm. So in one first month or two of working, I had someone come in who needed, I think, 28 teeth extracted or 26. Like they needed all their teeth out. And as a new graduate, I was a little bit intimidated by this. So I said, I'm going to send them to a specialist nearby who can, is more comfortable doing this procedure. Now, I saw this person come back several months later, and they told me basically the person wouldn't see me because I couldn't pay the difference up front. The difference between the fee guide for social services and the, normally the fees that they charge. So this person would have had to pay an extra maybe $1,500 out of pocket, and that's just completely out of the question. So it was something that was really a shocking thing for me because I thought, people who are covered on these social services or, they can at least access some care, but it's oftentimes they can't. There's the odd nice dentist who will see people here and there, but it's just not enough to set a system up like that. It will systematically neglect them.
Yeah, that's a good point. There's for sure people out there who can sympathize and, even empathize, understand that, okay, it is hard for people to come up with this and I'll be the dentist who does that, or I'll do it in certain situations. But in that instant that I was in where my tooth was in just blinding pain it had to be over a week at this point because I was trying to figure out what to do because I knew I couldn't afford the root canal, even with a dental plan. And so I would be calling different dentists to see if they did, and none of them would. I was just like, I have a plan. It will cover it, but I can't afford to pay the $2,000 up front and wait a month to have it reimbursed. Yes. And they just were like, well, we're very sorry, but we don't do that. And that was it, and it's, in some sense, you can't blame them. It is the system that they operate within, but the whole system does need to be changed. I mean, these are very important parts of people's basic healthcare that need to be taken care of. And also, if people could, if it was covered, people could and wouldn't mind, except for people obviously who have phobias of the dentist, but they wouldn't mind going in for regular checkups, just to get it done and make sure that you're ahead of the game. It's not, I've never had a problem with going to the dentist. I've never had a fear of it like some people do. So I was blessed with that. I just had a fear of the cost. So if it was something I could just go and do every 6 months to make sure my teeth were in order, because I'm getting up there. I'm almost 40 now, and I don't go to the dentist very frequently or rarely. I know that it's going to become more and more of a problem. So it's something that I would love to have the opportunity to get ahead of and have done. So.
Yes. And one of the things with this is when you neglect those early interventions and like preventative treatment, the problems only compound and get worse. So it becomes harder and harder for people to afford it. So, a lot of people need to ration the money they spend on dental care, and then they have to focus it on dealing with pain and infection rather than getting small cavities treated. Mm-hmm. Well, when you're rationing that money, what happens to those smaller cavities in the meantime? They get bigger and bigger, which becomes more expensive down the road.
Yes, yeah. I actually lived in the UK for a while. Um, they have an interesting system over there for both healthcare and dental care. Healthcare was surprisingly open. I was shocked because I was living there and I had a visa that I was living under. So I brought like all my information to the doctor one time when I wasn't feeling well, and they asked for none of it. They just asked for
Wow.
my name only to call out while I was there. So that I could go in, but they just have a pretty open door policy. If you live there, if they don't ask if you're an illegal immigrant or anything. I mean, I'm sure some people might have had different
Yes.
encounters. I'll talk about from my thing, but I mean, I'm over there. I sound like this. I'm not from the country, and they were just like, yeah, well, come in. The guy checked me out and offered a prescription for something that I needed. So that was different. Then I had a tooth problem when I was there as well. I had a tooth that cracked, and I think it was a neglected cavity, and it just sort of popped out a sort of a more, instead of cracked, like sort of a hole in my tooth. And I went to the dentist, and it was 60 pounds, so about a 100 Canadian dollars. They did a cleaning, a checkup, said, yep, that was a little cavity that we can fill. And then I came back a week later, and they filled it, and that was it. I didn't pay any more than the original 60 pounds. The way it works over there is if you get a checkup, they take a look at it and go, okay, here's what you need. You need a root canal here, and you have 2 cavities that need to be filled. And all of that is covered under the initial 60 pounds. It's whatever treatment you need afterwards. So it encourages you to go in, spend the 60 pounds every 6 months to get the checkup, and then come back and get all the work done. So they have it nailed over there.
Yes, and it's something that Canadians don't realize that many other countries actually do cover dental care. So the UK is one example, France is another. There's many examples of this. And Canada is really unique in how poorly the government funds dental care. So if we look at dental spending in Canada, about 95% of it is private. So out-of-pocket payments are through private insurance, whereas only 5% is from government programs, which is actually the second lowest level among developed countries, even worse than the United States.
Oh, wow. That should be all it takes to get Canada to step up its game. Is just, look, you're worse than the United States in this aspect of healthcare, and go, okay, all right.
Yeah.
What else? So you started this. How long is this project? What's the name of the project?
So I started a group called Coalition for Dental Care back in January. I went to the Canadian Dental Student Conference in Vancouver before the pandemic and gave a presentation basically saying, here's the problem, which is private dental care in Canada, and here's what I think are the solutions, which we'll get into more later. And the gist of it is we need to integrate our dental care into our Medicare system. And as a dentist, as medical workers ourselves, we believe that is our responsibility to be on the front line advocating for these issues and bringing these issues to the forefront. So it's really something that I'm trying to help organize dental and medical people who work in the dental and medical professions to try to help organize them to push for this cause, as well as working with the public and help building this organization that can really, have capacity to take on different ventures.
Have you caught any shit from other dentists? Are there dentists who are against this, or has it mainly been accepted and you're just gathering more and more people within the profession to join you on the front line?
Well, I'm sure there's a lot of dentists who don't like it. To be honest, from my experience, there's a lot of dentists who just don't really see this as their problem. A lot of them grew up in a privileged background where it's just not something they experienced. And I think for me, it takes my point of view on this is it takes a lot of humility to really sit there and think like, it could have been me who couldn't afford dental care. And if I was the person who was suffering with chronic dental pain because I couldn't afford it, I would want people in those positions of power to be advocating for the things that I'm advocating for. So I believe it's my responsibility. And I think there are many dentists who agree with me, but There are many who don't, but I think from our perspective, we need to get the people who are interested and help organize them in a way where we can push for these things in a uniform way, apply pressure on governments, and educate the public.
No, it's great. It's honestly a great movement, organization, and any one of those ways to label it. It's a great cause. It seems like a really important thing to do. It's just it's like anytime I have gone to the dentist, or if you hear of people who go and then the dentist says like, well, you should really be coming in more regularly. You almost just, as somebody who can't go regularly, you almost just want to say was like, I don't know, maybe you could do something about that. Like
Yes.
you could actually be, if you think this is so important, if it is so important to go and do this, then maybe you could be somebody who speaks for people who do need this. So it's actually great to meet a dentist. Because I remember my girlfriend went to the dentist a couple weeks ago, and there was just a couple, I guess, sort of exchanges or comments that she felt like the dentist was kind of being a dick. And I was just thinking, like, if I was there to be in a dentist chair and have a dentist be a kind of a dick about the state of my teeth, I'd be livid, because I want to go to the dentist,
Absolutely. And I think that's something that a lot of dentists just don't see this as their problem. They try to frame it as a shortcoming of the individual rather than result of how we structure dental care in Canada. And the fact that dentists by and large are in a socioeconomic class where they don't experience this problem, I think just they're isolated from these issues.
Yeah. And aside from dentistry as well, I think a lot of issues that is kind of the situation. People who don't ever experience, this is just one, very specific one, but I think that isn't in general sort of situation. People who aren't in these positions don't appreciate how difficult, painful, and depressing these situations are. When you can't get a tooth fix that hurts, or you can't get the proper care, so you have to pull it. That's a real punch to the ego, as opposed to being able to properly, because we all know what the stereotype of people with missing teeth are. And I think a good point that you made as well is a job interview or holding down a job. I mean, if, there's very few jobs that you could possibly have where noticeably missing teeth would be an acceptable thing. I mean, a saloon bartender in the 1800s would probably be one where you could probably still do it. But you're not going to be a salesman. You're not going to be somebody who's in the public sphere with that. And I think that's really important. I mean, it's fixing that, different programs that could give people, a clean suit to wear to a job interview, and we have those programs. There are programs like that exist in job interview coaching. But if you're not going to fix the teeth, you're not really doing enough.
Yeah, and it's something that there was actually a study that looked into the benefit of providing people struggling with drug addiction with dental treatment. Mm-hmm. So they had people going through addiction treatment, and they broke these people up into two groups. One of them they provided with comprehensive oral health care, and the other ones they didn't. And what they found was that the group that they provided comprehensive oral health treatment with, they were more likely to complete addiction treatment. They were more likely to find a job. They were less likely to relapse and get addicted again. They were less likely to be homeless. Mm-hmm. So there's overwhelmingly positive benefits that went beyond their mouth, because just giving them dental care, giving them dentures, and providing the treatment that they needed really it gave them an opportunity, gave them a fighting chance to make it in this world.
Yeah. And it's just one of those things. I think it's, as you said here, and as other maybe dentists who aren't as on board or on board at all with this cause, the idea that it's one of those ones that doesn't seem as important for some reason, and it's in the background, but it is such an important thing to take care of. To be honest with you, as a comedian who most friends are comedians, this topic of conversation has come up a lot, because it is. Most of us don't live in the world where we get jobs that give us dental care, and it's a gig economy. You're hand to mouth, paycheck to paycheck, gig to gig. So, you're not always prepared. Even if you have some savings, you're like, but it took me a while to accumulate that, and I don't want to get rid of that for this problem, but I need to get rid of this problem. So it's really just a sort of a spiraling thing, like a spiraling issue that just affects so many people. And as somebody who was been personally affected by it, it was when I heard that you were doing this, I really wanted to have you on the podcast. So it was great. So this is your cause. It's where can people find it on the internet, on social media? What can they do to help?
So you can find us at Coalition for Dental Care on Facebook, Instagram, Twitter, YouTube. We're an organization that's still growing. We're trying to, establish ourselves and take on different ventures. So anyone who's interested, we're happy to have help and whatever ways in which they can help. So we have some people who are more artistic, some people who are good at kind of organizing things, who are able to help out with social media. There's all different types of ventures. As we grow capacity, we want to take on different projects. So one of them that we've been doing so far is writing various articles. We've been having events. We had one a couple weeks ago with some dental public health specialists talking about access to dental care in the era of COVID-19, which I really enjoyed that, and we're looking to have more events on the subject, but we're also looking to make different ventures as well. So one of them, I'm in the middle of writing a book right now on the subject, and we're also looking to make possibly a documentary film at some point. So there's a lot of different projects that we're looking to take on. It's just as we build capacity, we'll be able to take that on, and different people have different things to offer. So if someone has experience with, making movies or things of that nature, we can use them for, say, making a documentary film
Okay, that sounds great. So they can follow. It's I'm sorry, I keep forgetting. Dentists for a Coalition. Can you say that again?
Coalition for Dental Care.
There it is. Coalition for Dental Care. They can follow you find the Facebook group. They can follow you on Twitter, follow you on Instagram, so they can keep up to date on everything that's going on with the cause, the project. And then, so go out and follow them on social media, and then retweet and share, and then help to, at this point in time, you're basically just really trying to bring people's attention to the issue and the fact that you guys are out there trying to do something about it.
Yes. So really the push with Coalition for Dental Care, there's three main things that we are highlighting. So one of them is that over 1 in 3 Canadians lack any dental insurance. So what we think the best way to fix this is to give everyone dental insurance through our Medicare system. So just dental care should be included in Medicare. So people don't have to worry about losing their insurance when they become unemployed, if they retire, or if they work a job that doesn't provide dental benefits. Mm-hmm. So as you mentioned, you work in the gig economy. That's something that we know more and more people are working in the gig economy. So this is a growing sector. Mm-hmm. And also we see a lot of older people who are retiring and losing their work-related dental insurance. So the number of people without dental insurance is actually growing quite a bit, as well as the fact that we're in an economic downturn with COVID-19. So this is something that when there's an economic downturn, people lose their jobs. They're also work reduced to no paid hours. So they're losing their dental insurance because they're losing their job, and people are losing supplemental income to pay for these services out of pocket. So more people are going to be suffering. So we think that right now is a critical time to give everyone dental insurance. So that's kind of the first thing our group is focusing on. Mm-hmm. The second thing is public ownership of dental clinics. So rather than having private practices, like we think that our goal isn't to only have public dental clinics, it's to have a robust sector of government-owned dental clinics. The reason for this is private practices haven't been willing to set up in a lot of areas that dental care is very much needed. So many rural and indigenous communities have either no dentists or have too few to support the population. And then also other areas like in long-term care facilities, in schools, in prisons, things like that. These are all areas that dentists haven't been willing to go in large enough numbers and have systematically neglected these populations under the private practice system. So we think having government ownership of these clinics allows us to provide care in a more organized fashion to these communities. Another thing that it allows, and this kind of rolls into our third point, is breaking dentists' monopoly on care. So you go to the dentist and you get a filling and it costs you $250, $300. Why does it have to cost that much? It really doesn't. And this is something that we think what are known as dental therapists. They're mid-level dental providers, similar to the relationship between a physician and a nurse practitioner. So dental therapists provide simple procedures like fillings, extracting baby teeth. They can do cleaning, simple dental procedures, and they do so at a fraction of the cost of dentists. So they cost about a third of as much as a dentist would cost. And in these government-run dental clinics, we think dental therapists should do the bulk of the work as they're more cost-effective, so we can have more people go to these areas it's more bang for our buck, basically.
Right.
And dental therapists are used in many countries. So I think it's about 54 countries around the world. Dental therapists are part of the dental team. And they provide high-quality work equal to that of dentists, but at a fraction of the cost. One of the best examples of this is in New Zealand. They've had a children's dental program for almost 100 years where they actually provide dental treatment to children in schools, which is very helpful because it's much more accessible for everyone. A lot of low-income parents have a hard time taking their kids out of work and bringing them to the dentist. Also, in many rural communities, it's a long drive. I mean, where I work, I have patients who will drive hour and a half to get to the nearest dentist. But having them in school-based settings eliminates that problem and makes sure that all children actually receive the care that's needed. So it's a great equalizer in that sense. And we actually had a program like that in Canada and Saskatchewan in the 1970s and 80s, brought in by the NDP. And dental therapists provided treatment for children in the school-based setting. And it was highly successful, very cost effective, and it was wildly successful. Like the number of fillings that needed to be done after 10 years of the program went down by half because children's teeth were so much healthier. They were detecting problems much sooner. It was wildly successful in the public delivery of these things, along with the use of mid-level dental providers, was integral to having this happen this way. So we think that moving forward, we shouldn't just focus on school-based clinics, which we should have those, but we should also expand that to have community-based clinics in rural and indigenous communities, also in prisons and long-term care facilities.
Yeah, yeah, that's great. Dental care at school is such a fantastic idea, and honestly just makes so much sense when you hear it. You go, why are we not doing this already? Like the kids are there. You stagger when the appointments are, but they get it done in school, get their checkups, get the cleanings. It just makes so much sense.
Well, it's something that actually, when you were speaking earlier about dentists not always being the most receptive to patients not receiving treatment, like as much treatment as they should. I think another big problem is that the same with Medicare, doctors were the main opposition to government provided health care. And it's the same thing with dental care. A lot of dentists, they have moneyed interests that don't coincide with people having high quality, low cost dental care. So they oppose these things and they would rather have a private practice fee for service based model because financially it is beneficial to them. Whereas in reality, to provide high quality dental care to everyone in the population for the most efficient, cost-effective way possible, you're going to have public ownership. You're going to take the profit incentive out of many levels of care, and you're going to have salaried providers. So it's much more cost-effective to have a dental therapist performing simple fillings because, there's pretty standard procedures, and then you can have dentists focus on more complex procedures like root canals or surgical extractions or, more complex procedures.
Mm-hmm. Yeah, it just makes sense. It was great talking with you today. Before I let you go, though, do you know who the fifth dentist is that won't recommend Dentine gum?
I have no idea.
I honestly just thought of that hack joke like 2 minutes ago, and I was like, you might as
That's
well do
funny.
it while you're here, because they're always with the 4 to 5 dentists, and who is this fifth guy holding out? I think I'm actually just doing a Jerry Seinfeld bit right now, so I'll cut it short. Honestly, though, it was great to talk to you once again. Do you want to say where people can find you, follow you, and help support the cause just by giving a follow and learning more about it?
Yes, so you can find us at Coalition for Dental Care at Facebook, Instagram, Twitter, and YouTube. Through there, you can contact us. You can attend future events and give us ideas to help advocate for universal dental care.
That's great. It was really great having you on today, Brandon. I really appreciate it. Thanks for joining me.
Oh, thanks for having me.
No worries. Good luck out there.
Thanks.